Hello everyone, welcome to Health Tips. I'm Kemi and today we'll be talking about cardiopulmonary resuscitation, which is also shortened as C.P.R. Now, what is C.P.R? C.P.R is an emergency procedure done to save a person's life when their breathing or heart stops. Now let's look at situations where you do C.P.R. C.P.R can be done in any situation when a person is unresponsive or not breathing well, which could have been as a result of anything ranging from drowning, cardiac arrest, suffocation, electrical shock, and so on. So now let's talk about what you need to do CPR. What do you need to do CPR? As a person, all that you need to do CPR is the knowledge of CPR and your calmness, because CPR is a step-by-step procedure and you can miscalculate if you are agitated, so you need to be very calm. Now let's go to the procedure. How is CPR done? Before I move to the first step of how CPR is done, I want to remind you that in any emergency situation whatsoever, the first thing you do is to call the emergency line or arrange for transfer to the hospital while you start your first aid, because CPR in this case is only to keep the person alive for a while until the arrival of full medical attention. So once you see that a person is not responding, is not breathing well, or is in shock, or has a heart attack or something, the first thing you do is call the emergency line or order someone to start making arrangements for transfer to the hospital. Then you can start your CPR. Now, how is CPR done? The first thing you want to do in CPR is make sure the person is lying flat on his back on the hard surface. Once that is ensured, you kneel beside the person's chest. You are kneeling down straight beside the person's chest. Then thirdly, you place your palm, your hand, the heel of your palm. This is the heel of your palm. You place the heel of your palm on the center of the person's chest and you place the other on it. Once that is done, remember you are kneeling straight. Now you are going to give 30 compressions and you are going to count this way, 1, 2, 3, that way. So you'll be counting 30 compressions, and like I said, you need to be calm so you don't miscount, because the counting is actually important and the reading is very important as well. So you give 30 compressions. Remember, when you are giving the compressions, you are not bending your elbow, because you want to exert your weight on the person's chest. So be careful not to bend your elbow in the process. Your elbow must be straight. After the 30 compressions, you use one hand to tilt the person's head towards the back and use the other to lift the chin. And then you pinch the nose gently and give the person 2 breaths, which is also called mouth-to-mouth respiration, or we also call it kiss of life. So you give this person 2 breaths. That is a way to introduce air to the heart. Once you do that, you listen if there is any sign of breath or if the chest is rising or falling. If that is not happening, then you have to go another round. That is, give the person another 30 compressions and 2 breaths of life. You have to continue this way until there is sign of life, or until medical attention arrives, or until a medical professional tells you to stop. So that is the procedure for CPR. Please note that this CPR procedure is only for adults. Age 12 years and below have their own CPR procedure. And lastly, I want to remind us that for every minute that is wasted when a person's breathing stops can actually claim the person's life. So every minute counts. As a matter of fact, research shows that survival rate can increase between 10 to 15% if CPR is administered timely. So you see why you cannot waste a minute. when there is need for CPR. And again, I would like to remind you that you don't have to be a health professional to give first aid. Anyone can do CPR, and everyone should learn to do it. Thank you. Have a lovely day.